Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about what is QDWI program in medical billing. We know very well that this is one of the Medicare saving program. I already discussed about other Medicare saving programs like QMB, Qualified Medicare Beneficiary, SLMB, Specified Low Income Medicare Beneficiary, and QI program, Qualified Individual. I would like to provide those videos links in the comment of this video. If you would like to explore more information related to QMB, SLMB or QA programs, you can explore. And also guys, I would like to explain in this video especially what is QDWI. It stands for Qualified Disabled and Working Individual, and who are eligible for this QDWI program, and what are the basic eligibility criteria for the QDWI program I would like to discuss in this video, and also what kind of benefits you will get if you are eligible for this state program. I mean state government program will provide this QDWI benefits, right? If you are eligible, what kind of benefits you will get as an individual from that respective state, that benefits I would like to explain in this video. And also everything is okay, how to apply? Then you are eligible, you confirmed that you are eligible for this program, then how can you apply for this program? I would like to explain. And also, if you are working as a AR caller or otherwise you are a doctor, you are submitted claim to insurance, right? At the time insurance is not giving payment, they are deny the claim stating that non-covered services. And also there are a deductible PR1, PR2 co-insurances, PR3 co-pays. These all are non-covered as per patient plan, because patient enrolled in a QDWI program. At that time, what kind of action you would like to take? As a doctor, you can write off the claim, or otherwise, as a doctor, you can submit this patient responsibility or non-covered charges to the patient. So patient responsibility, or otherwise it's a doctor responsibility if insurance is denied stating that patient already enrolled in a QDWI program. So this kind of all information I would like to explain in this video. Sorry guys, for example, sorry guys, for if you are watching our video first time and if you not yet subscribed, I'm requesting you to, could you please subscribe our channel and turn on the notification so that you will get every our video as a notifications to your desktop or your mobile. So kindly subscribe now only. And this is I am small help I am expecting from you. Hello guys, now we are discussing about QDWI program. Your QDWI stands for Qualified Disabled Working Individual. By name we can understand that the individual should be disabled and also working. At the time this program is eligible for that particular individual to get the benefits from a traditional Medicare. This QDWI program is given by state government to the people, to the individuals, to get the benefits from a Medicare coverage. How they will get the benefits are nothing but this QDWI programs will pay the premiums to the Medicare Part A. In that way, these individuals get the benefits. So this QDWI will give the premiums to the Medicare on behalf of that individuals who are eligible for that QDWI program. So here the QDWI covers the Medicare Part A premium for working people under age 65 who have a disability. QDWI program is less commonly used other than Medicare saving programs like QMB or SLMB or qualified individual QI. So the QMB, SLMB are very commonly used Medicare saving programs, but here QDWI is less commonly used. Why? Because there is a criteria that person should be under 65 with a disability, and also he should be also working individual, then only this QDWI is applicable. And I also given a note point that each state administrates its own QDWI program. States may have a different QDWI income limits. So that is why the individual need to talk to respective state health assistance program SHIPs to see if if they are qualified for this program or another program. So that is why you should have to inquiry with your state health insurance assistance program to you are a qualify to this program or another program. But we can understand that this basic criteria like disability working, we can understand we are eligible for this program. But here why I given this point means, for example, you are getting higher benefits compared to this program, it is a better to take that higher benefited Medicare saving program instead of QDWI program, because other programs also providing Medicare Part A premiums, also Part B premiums, but this program is only providing Part A premiums free to that QDWI program. For example, you are also eligible for QMB program. For example, at that time it is a better to take a QMB program instead of QDWI program, because in QMB program both Medicare Part A, Part B, deductibles, everything will be covered for that particular individual. But in QDWI program only Medicare Part A premiums will be covered to that particular individual who are eligible for QDWI program. Okay guys, now we will discuss about who qualify for QDWI program. To eligible for QDWI program, you must disability. So you have a disability, because this program is only for the disability persons. If you are not disabled, you are not eligible for this program. And the next eligibility criteria is you should have to return to work. Means you have disability but you are not doing any work, then also you are not eligible. So the criteria is you should have to disability and also your return to work, means nothing but you have to doing uh, work, nothing but you are a working individual. So the both, you have a disability and working, at the time only you are eligible for to apply this program or you are qualified for this program. And last Medicare coverage, for example, what happen, for example, you are doing job, at the time you are getting earnings, right? Even you are disabled, you are doing your job, you are getting your earnings. So means you are getting earnings means you are not eligible for state Medicaid, because your income limit is good. And also you are not eligible for coverage also, because you will lost Medicare coverage. Why? Because you have a earnings, you have a good income limit. This Medicare saving programs for the people who are have a limited income and resources. If you are getting your income from your organizations, then you are not eligible for this low government programs, right? They are not eligible for your government benefits, nothing but your federal insurance, nothing but traditional Medicare, and also state Medicaid, state insurances, nothing but state Medicaid. These all benefits you will be lost if you are a working, right? So that is what the people who lost Medicare coverage but they are working as a disability, for them it is useful to apply for this QDWI program. So here the concept why I given low Medicare coverage means you have a loss of Medicare coverage. Why? Because you are earning money, but you are earning money with the state of disability, because your physical state is nothing but disability. You are doing job but you are not in a good condition, you are in a disability. That's what you are a qualify for a QDWI program or last Medicare coverage as a working. Sorry, sorry guys. And if you are a qualify for QDWI program, you should enroll in a Medicare Part A. So as an individual, you should be enrolled in a Medicare Part A to get benefits. To qualify this QDWI program. And final fifth point I given like a important. It is a have a limited income and resources. So you have a doubt, okay? In this QDWI program, already they are a working, right? If you are working, they don't have a limited income. Obviously, they are have a good income. So even you are a working, even you have a disability, you have to have a limited income for this QDWI program also. So what is limited income or standard income for this QDWI program for a individual monthly for the year of 2025? I given like a individual around $5,000 and 302 cents and less than that. That is the standardized income limit which is decided by the federal, right? And coming to resources, so couples also I given, please have a look on this figure. And here resources nothing but there are also standardized resources limit for every Medicare saving program. This is there is limited income and resources, standardized income and resources are there for every Medicare saving program, even for QMB, SLMB, QI, QDWI, for everything we have a standardized income resources limit. You should have to verify that information in your respective state uh, portals. Here resources limit in for individual it's a $4,000 even or less than that for the year of 2020 2025 will be used. Here resources nothing but generally, for example, if you are a having money in your saving accounts, and you have a mutual funds, you have a like debts like mutual funds are there, or some other debt funds are there, and some other bonds also there, right? This kind of all things will be comes into the resources. So that will be up to the limit $4,000. Even if you have a if you have a more than $4,000 as a resources limit, you are not eligible for this QDWI program. So these limits are given and given by the government. So that is better, you have to verify this information before you are applying for this QTWI program. And these things will be common for all states, but few states like for example Alaska and Hawaii, this kind of states have a higher higher income and resources thresholds compared to other states. If you are belongings to this Alaska or Hawaii states, please look into your uh, respective state limited income. I mean, respective state income and resources before applying this. Okay, but here the key factors like important thing is you have a disability and working individual, and also you are Medicare Part A enrolled. These things will be very important before applying or qualifying for the QTWI program. So here the question is, what does QDWI covers? Here the QDWI pays are giving the benefits, nothing but pays means benefits for Medicare Part A premiums, hospital insurance. So if you are a qualify or if you are a eligible for QDWI program is nothing but your state government will pay in the form of program QDWI program to the individuals. What they will pay? They will pay the individuals of that people, that I mean the premiums of that individuals for Medicare Part A premiums, hospital insurances. So that is what the QDWI benefit which is given to the individuals who are working and disabled in that particular respective states. I given note point, the QDWI program does not cover Part B premiums, does not cover PR1 deductibles, right? PR2 co-insurances, and or anything related to Part B and Part D or Medigap plans. So here we have to understand that QDWI will cover only, I mean the QDWI program only pays for Medicare Part A premiums. They will not pay for Medicare Part B premiums. They will not cover for deductibles, co-insurances. So that is what we have to understand before you have to, apply for this QDWA program. Okay, you are working individual and you are disabled person and you enrolled in a Medicare Part A and you have a limited income and resources, then you understand and you called also, or you are confirmed, at least you can understand, right? You are able to apply for QDWI program. You are eligible to apply for QDWI program. Then how to apply is the question. How to apply means apply through your state Medicaid office. You have to reach out your state Medicaid office. For example, you are belongings to one state, that particular state have a Medicaid office. Please apply through your state Medicaid office, since it is a Medicaid administrated, I mean administered program or associated program. So it's a Medicaid administered program. Since it is a Medicaid program, it is a better to reach out to Medicaid office. How to reach out? Here most states allow applications through online also, by phone, by mail, or in person at a Medicaid office. If you reach out to Medicaid office, there is a person is available at a desk. You can reach out him, get an inquiry, and apply for QDWI program. Before you can apply, they will also understand your situations and conditions, like criteria for eligibility things. After that, they will proceed. Okay, so here you are a working as a AR caller, or you are a doctor, or you are a billing doctor. So you are submitted claim to insurance. Insurance is acknowledged your claim, and they completed adjudication. After that, they process the claim, and finally they denied the claim. Nothing but they are not giving any payments to your doctor. Simple, they are telling that your claim is denied. We are not giving payment to your doctor because patient is eligible for QDWI program. That is what we are not covered your services, whatever you build. So, if the patient is eligible for QDWI program based plan, then what we will do, that claim can we bill to patient? Or if that claim, for example, you submitted claim to primary insurance and they processed and paid, they cross out the claim to, for example, state Medicaid. They are forwarded, not cross out, forwarded. At the time, the respective state Medicaid, sorry, the respective state Medicaid process the claim as a secondary, and they will deny as a non-covered services. Whatever primary applied, PR1, PR2, PR3, whatever it is, it might be mostly PR2, that will be not covered by insurance, secondary insurance. They are telling that because the patient is eligible for QDWI program. Then what you will do, can you bill patient or can you adjust? As a doctor, you can adjust or you can bill to patient for that balance of, for example, primary paid $80 of a billed amount of $100. $20 is applied as a co-insurance by the traditional Medicare and claim forwarded to state Medicaid. The state Medicaid processed the claim and they denied it as a non-covered, as a secondary insurance for a PR2 of a primary. The $20 is there, balance is there, the $20. What, as a doctor, we do like to bill to patient that $20? Please, you have a alert, you have a note that patient is eligible for QDWI program. Already government is giving assistance to program for the disabled person at the time. Can you bill to patient, or otherwise you can adjust, is the question. For that the answer is you can bill to patient. Even the state government is giving or administrated or assisted to that particular individual who are working as a disabled and working. Can we bill to? No problem, yes, we can bill to patient. Why? Because patient is getting earnings from that organization, because patient is getting payment from that insurance. So I mean, sorry, from that organizations who are working. For example, patient is working for some organization, there patient is getting earnings. So in that case, if Medicaid is denied as an uncovered, even the patient is eligible for QDWA program, you can bill to patient, because patient is getting earnings, so that patient might be pay for it. Here the points to be noted is, in QDWI program, just now we discussed that we can bill to patient for a co-insurances if insurance is denied as a non-covered services. For PR1, PR2, PR3, all those things we can bill to patient. But in QMB program we are not supposed to bill to patient. In SLMB program also we can bill to patient for co-insurances, co-pays or PR1s. Why? Because he is a specified low income, but not like a other like other individuals are low income default, but these are the specified low income. In QMB also they are fully low income peoples. So in QMB we cannot bill to patient. In SLMB we can bill to patient. In QI program also we can bill to patient, and also in uh, QDWI program. In this program also we can bill to patient for PR1, PR2, PR3. You have to note that point as a key point. If you are working as a AR caller, or if you are a doctor, then you have to note this point. Here in this QDWI program, very key point is, you are eligible as a disabled, I mean, sorry, you are disabled person and also you are a working individual to stay eligible. Here you have to check this eligibility annually. For example, your income limits will be changes, right, per year. At that time it is a, might be you are eligible or not eligible. If you are exceeded that income limits of resources limit, for examples, then you are not eligible. So that's why it is better to check your eligibility annually. If you are not meeting that limits or you are exceeding that limits, then your QDWA program is not giving any benefits to you. And we have to understand that insurances and your, if insurances deny the claim means, mostly it's very rare, because if you are eligible for QDWA program, obviously you will be getting benefits. Benefit here, what is the benefit? Then you have a question like, so for patient responsibility like $20, very less, PR1, PR2, PR3, they are billing to patient for QDWI program. Then what is the benefit of getting this QDWI program? See, here the benefit is not for small balances of $20 and like that. Here the benefit is premium. Medicare Part A premium will be given by the state government if you are eligible for this QDWI program. So if you know the premium is not in like $20 like that, right? The monthly premiums for Medicare Part A for a hospital insurance, it's very high. So that will be paid by the state government if you are a working and disabled, and if you are a under the limits, then your respective state government will take care of you. That is the benefit. So For example, you have a doubt, okay, we are eligible for QDWI program, and also you are billing to me as a $20. Then what is it? No, that is $20 you are getting earnings, so that's what they are billing to you. They are, that's what you are responsible to pay that. For example, if you are a eligible for QMB program, sorry, for example, you are eligible for QMB program, then the doctor will not bill you for your PR1, PR2, PR3 also. $10 also they will not bill you, because you are completely low income person. Sorry. That is what we have to understand. Here, Medicare Part A premium is the benefit to the QDWA program. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people. And if you like this video, I believe that it will reach us them easily. And I'm requesting you, if you have any suggestions or feedbacks, or we would like to discuss about some new topic, could you please do your valuable information as a comment to our video, so that I would like to make a video accordingly. For example, you're asking about some new topic in our healthcare domain, or anything like denial, or like for example notes, AR notes, or denial, or you have any other clarifications you have, make it as a comment so that I would like to uh, make a video accordingly based on your interest. And also I would like to correct myself if anything is like we would like to learn like a together and we grow like together, no problem. I would like to respect every your comment to our video. And again, I'm telling thank you so much for your time. Have a good health. Bye for now.